Good evening, everyone. We're so happy to have you here tonight. Thank you for hopping on. I know you're very, very busy and your schedule is very important. So we want to make sure that we get through this so that you have your time to get back to your families. My name is Maura Snyder. I am the Child Care Resources Coordinator with the Child Care Development Program in the Division of Welfare and Supportive Services. The team at the Child Care Development Program was tasked with administrating federal funds to help the child care industry through the COVID pandemic. And one of the areas that came to light through that was that the funding administration is the lack of benefits available to our child care providers. So we reached out to our partners and came up with a solution. And we are able to bring you 2 years of telehealth services benefits through the Nevada Registry. This means the Child Care Development Program will be paying those monthly premiums for you for that service for the 2 years for anyone that is qualified eligible candidate at no cost to you or your family. So we're really excited to be able to bring that for you. We recognize that this is a small step into really professionalizing the industry and showing how much we have heard you and recognize the needs that need to be met. But we're hoping that this is just a small step into a greater expansion of that. So with that, I will go ahead and turn the time over to my colleagues. I have Shelly and I from the Nevada Registry, Brandon DeCesar from Optima, and Michael Goff from the Allied Health, and they're all going to do a presentation to show you the various ways of how you're going to sign up, what goes into it, and all that good stuff. So once again, thank you so much for your work that you do and being here with us tonight.
Good evening, everyone. I'm Shelly Nye. I'm the program director for the Nevada Registry, and it really is my pleasure to be here with you guys tonight. You do such incredible work, and it's so exciting to be able to bring this tremendous benefit to our workforce. So as Maura mentioned, this program, sorry, I'm just going to advance. Okay. As she mentioned, this program does provide tremendous benefits to our workforce. It will grant eligible registry members access to unlimited telemedicine calls and up to 10 teletherapy sessions per family per year at no charge for up to 2 years. It allows you to visit a doctor or therapist online at your convenience and is a benefit to you simply for being part of the ECE workforce in Nevada. There really are no strings attached. It truly is as good as it seems. Open enrollment for the program will begin in about a month from now on January 15th of 2023. And benefits for those who opt in right away will go into effect as of February 1st. And benefits will be available through February of 2025 for a 2-year period. Brandon and Michael are going to talk more specifically about the services that will be available in just a minute. But first, I'd like to talk a little bit about eligibility. Eligibility criteria is 2-part. The first part is that you must be an active member of the Nevada Registry. The second part is that you must be working in a program that is eligible, as defined by the Division of Welfare and Supportive Services. The list of eligible programs is listed on your screen. So basically, if you work in any of these types of programs and are an active member of the Nevada Registry when the program launches, you will be eligible to enroll into this program. I want to mention here that though the open enrollment begins on January 15th, enrollment's open for the entire 2 years of the program, allowing members who become eligible at a later date to be able to enroll anytime between February 1st of 2023 and February of 2025. You don't need to enroll on the 25th to be eligible, though we're aiming to have as many registry members enrolled before February 1st to provide a full 2 years of benefits. As far as the enrollment process, as I mentioned, the open enrollment begins on January 15th of 2023. If you're eligible, you will see a new yellow tab titled Telehealth Services Benefit Program in your registry online portal account. But you're not going to see this tab prior to January 15th. That is the day that the program officially launches and open enrollment begins. You'll enroll in the telehealth program via your registry account. And though the registry is the vehicle that gets you to the telehealth program, we're not the service providers. That's you'll hear more from Brandon and Michael about the services that they're going to provide once you're enrolled. You'll be required to verify your personal and employment information. And if any updates are needed, you'll first need to submit those updates to the Nevada Registry for review and processing. Our updates are generally processed within 1 to 2 business days, but could take longer if we receive a huge influx of updates on the day of launch. Once you've updated your information, if applicable, and confirmed that the information on file is accurate, you'll be granted access to the release of information and enrollment authorization form for the telehealth program. After agreeing to the terms of the program and electronically signing your authorization form, your information will be sent to the Optima Benefits and Payroll Group for processing. All correspondence from that point forward will come directly from their office. There are 2 caveats I'd like to mention at this point. The program is slightly different than the stipend program because you aren't necessarily applying for the benefits, but instead are enrolling into the telehealth program through an authorization release that allows information sharing between the Nevada Registry and Optima Benefits and Payroll. The second is that eligibility is tied to your employment at an eligible program for the duration of the benefit period. If you leave the field, become unemployed, or change jobs to a program that is not included on the list of eligible programs that I shared on the previous slide, your benefits will not continue. So it's really important that if you move to another facility at any time in the next 2 years, that you update your employment with the Nevada Registry immediately to avoid a lapse in eligibility and access to those tremendous benefits. Before turning it over to Brandon, I'd like to just talk briefly about what you can do now to prepare for open enrollment. So again, the tab will be available in your account if you're eligible on January 15th. What you could do now to prepare is the first thing I would encourage you to do is to log into your registry portal account to review your personal and employment information and update it if need be. Your enrollment to the telehealth program will be quick and easy if everything is current on the day that the program launches on January 15th. To kind of put it in perspective, we received over 700 employment updates in the first 4 days of the launch of the stipend program, which of course impacted our turnaround time. So don't wait until January 15th. Log into your portal now, check out your information, and submit an update now so you're ready to go on January 15th. The second thing that you can do is renew your membership as quickly as possible if it expires between now and January 15th. Again, don't wait till January 15th to do this. Members are eligible to renew up to 45 days prior to their certificate expiration date. So there's really no reason to wait to renew your membership. Doing so could delay your access to the enrollment form. Because again, to give you another example of sort of what we anticipate, we received over 200 membership renewal forms in the same 4 first days of the stipend project. So of course, we want to be able to get you access to these benefits as quickly as possible. So if your information is current and you're an active member at the time of launch, it'll be quick and easy. And if you're a director, please check your employee list to ensure that all of your staff are members of the registry. If they aren't, submit their names to our office so an account can be created and they can initiate the online application process and become active members before January 15th. Keeping in mind that individuals who are in the process of completing the application or are in an incomplete or inactive status will not be eligible to enroll until they officially become an active member of the registry. Getting ahead of the game will definitely help come January. If you have questions going forward about how to access the enrollment form, please feel free to contact our office on the Contact Us page of the website. And if you select the Telehealth Services Benefit Program as your reason for inquiry, you'll probably get the quickest response. So now I'd like to turn it over to Brandon DeCesar with Optima Benefits and Payroll, who's going to talk more about what to expect after you've enrolled in the program.
Great. Thank you, Shelley. So yeah, very excited, just like everybody else here, to get this launched for the childcare folks in Nevada. My name is Brandon DeCesar, president of Optima Benefits and Payroll. And I was the one that assisted the state of Nevada with bringing this great benefit to all you fine folks, and hope that you can really find some value in this program. Our job at Optima will really be kind of your liaison between your obviously employment through your childcare center and this benefit program that's being launched. So Optima, in essence, will become your account admin, your support for any questions, issues, problems that you foresee or have, getting signed up, getting registered, having access to the program. That'll be an area that we will help assist in making sure that all your needs and items are addressed in a timely manner. So my information obviously here is on the screen. I'd like you to take that down so that you can get in touch with us if need be. We're obviously here to help you and make sure that this is a successful program for everybody. In doing so, as Shelley mentioned, we're going to have access to your information that we will then use to enroll you into the ALLYHEALTH telemedicine and teletherapy program. But there's still a step that you'll have to make once that is completed. So you'll also receive, once you have been set up with coverage, you'll receive a registration email that will allow you to then have access to your portal that you can set up for your access to the plan. That's where you can also add your family members to your policy. So your spouse or your children will be eligible to be on your policy, but you won't be able to add them until you receive that initial welcome email from ALLYHEALTH to get your account set up. So it's very important that once you do all the stuff through the registry, we get you set up through ALLYHEALTH, that when you receive that registration email, that you go ahead and complete that, because that's what's going to give you access to utilize services. There's certain medical questions that are asked upon that registration, and so there's certain things that are needed in order for you to have final access. So there is a few steps and hurdles that need to be, jumped through in order for you guys to have this program up and running. But we're here to help with all of that. So if you run into any problems, you have issues, somebody's trying to charge you for a visit, all of these things and all these services are completely free to you. And so, that's where if there's ever a mix up or something that's not going the way that it needs to, you need to reach out to Optima right away, and we can help address the issue or the question that's going on. We're also hopeful to bring out additional benefits to you guys. So hopefully in the very near future, we can provide you things like dental, vision, whole life insurance options. And so those are things that are also in the works. So as soon as you're able to, opt in to our programs, we can start communicating with you on those other opportunities as well. So, the sooner you guys get up and running with the registry, the sooner we can get you guys set up with coverage and you can start utilizing these great benefits. And Michael will go through his side of it, where obviously he's Mr. ALLYHEALTH. He'll give you all the ins and outs of everything telehealth and telemedicine. So Michael, go ahead.
All right, so let me share my screen and go through my part of this with everybody. So again, thank you everybody for taking the time to join us tonight. I know you have a lot of other things going on in your life, but I will tell you from experience that once you have the service and set it up, you will never want to go without it again, because it is the most convenient thing you can have. So ALLYHEALTH is the name of our company. We're the service provider. We've been in business now for over 12 years, very established, very professional company. And we have a couple of things that we really focus on. One is telemedicine and the other is mental health counseling. And those are the two services that you're getting paid for by the Child Care Development Program. So the first one is telemedicine. You may hear the term telemedicine. You may hear the term virtual care, virtual urgent care. All of those are the same thing. What the service entails is 24/7, 365 days a year, access to talk with a U.S. board certified doctor for really anything that is not an emergency. So if it's an emergency, you obviously need to go and seek medical attention somewhere. But for all the other things that go on throughout the day or throughout your life of minor illnesses that come up for you, your spouse, your kids, your dependents, that are, just seem to always come up at certain times of the year, those are the kind of things you can call and talk to a doctor for. Our service is good in all 50 states. So, if you're in the state of Nevada, that's great. If you happen to be traveling, if you're on vacation or anything, you need to use a service, you can do that. So The doctors themselves that you will talk with when you have any type of an issue are all US board certified physicians. These are normal, everyday practicing doctors. They may be working in a health system or a hospital or have their own private practice. It's not a call center full of doctors. These are doctors that are practicing medicine all day, every day. They have elected to block off certain hours of the week to be part of our network. Obviously, they get paid for that. So I just bring this up so you guys know that these are, very high quality doctors. They go through additional certification, additional credentialing. There's a lot of quality control that we have to put in place. And a lot of them are working in family practice, internal medicine, pediatrics, or even emergency. Some of them are multilingual. So if anybody on the call or any of your colleagues, coworkers, for example, if Spanish may be their primary language and they want to talk with somebody whose Spanish is their primary language, they can do that as well. It's over 3,000 board certified physicians, and they represent over 5,000 different medical licenses. So they might be licensed in more than one state for you to access. When somebody calls in and talks with a doctor, the average callback time or the average connection time to talk with a doctor is only 6 minutes. So think about every time you've been to the doctor, and I've done it many times with my kids where I sit in the waiting room for a long time, or sometimes you're only in the waiting room for a few minutes and you went to the exam room and you wait in there for an hour. So the average callback time from the doctor is 6 minutes. Of all the phone calls and consultations that our doctors field, 94% of them are resolved, which is a very high number. So with 94% being that high, our message to you always is use this as your first point of care. If you call and talk with a doctor and you happen to fall into the 6% that can't be handled via phone or video, and that doctor may then tell you, listen, you should go see a doctor. It only took you maybe 10 minutes of your day and didn't cost you a penny, but 94% of the time, those things are resolved. Everything we do is 100% HIPAA compliant. We have to follow all the privacy laws that any medical practice would. At the end of the call, when you talk with a doctor, if you want to have a transcript of that call sent via electronic medical records to your own primary care physician, you can ask the physician to do that. So if you want them to know, if you want your primary care doctor to know that you talk with this doctor through our service, just so it's on file, you can just ask them to send all their notes directly to them. Very importantly, a prescription can be called into your local pharmacy. So this is the same kind of prescription that you're going to get from your doctor. Most of them are short-term antibiotic type prescriptions because that's what most of the people are calling in for. That's up to the discretion of the doctor. If they feel a prescription is warranted, they'll send it in, and you choose the pharmacy you want it sent to, and then you go and pick it up whenever you are available. And also, you can request a follow-up consultation with the same doctor if for some reason your condition doesn't improve or if it gets worse. So if you don't want to start over with a new doctor, you'll have the contact info for that doctor through our portal. You can send them a message and set up a time for them to call you back. There's 3 ways to access a doctor. You can do it via phone. You call an 800 number. You're going to speak with a care coordinator who is kind of like an intake person. If you go to the doctor, they ask you a variety of different questions. Very similar. They're going to do that over the phone, and they have a doctor call you back. Again, the callback time averages of 6 minutes. You can also do a video call with the doctor. So you can do that simply by going into our website. And once you go into our website, you actually have the ability to search all the doctors, review their backgrounds, their biographies, and kind of see who they are and hand select a doctor. And then you can have a video call with the doctor. That may not be 6 minutes. There might be a couple of patients in front of you, but it's usually a very short period of time. And most people today are using our mobile app. So with our mobile app, you can go right on the app. You can schedule an appointment with a doctor for whatever time you want, or you can opt for the first available doctor. They'll call you back, and you can do it all right from our app. As Brandon mentioned, through our web portal or through the mobile app, you can also add dependents. So our service covers you and all of your legal dependents. So this is just a phenomenal service that you guys are getting brought forward for you. So the advantage of all this, you're going to save on copays. You're going to avoid paying deductibles. If you happen to have a health insurance plan that has a deductible, you're not paying toward that. You can get care for your family from the comfort of your own home. You're not using paid time off or anything like that, or any unpaid leave, again, depending upon your employment situation. I will tell you from experience, being a husband and a dad, The convenience of this service is unbelievable. It always seems that kids always get sick at 11 o'clock at night or at 10 a.m. on a Saturday. So instead of going to urgent care and sitting there for a couple of hours and paying a couple $100, I've done this. Call in, talk with a doctor, and get the same exact diagnosis. Prescription is called in. You never have to leave your house except to run out to the pharmacy. It's really a phenomenal service. The other service that you're getting is behavioral health. So behavioral health, also called mental health counseling, or maybe sometimes referred to as teletherapy, it's all the same thing, is extremely, extremely in demand right now. So right now, 25% of the US population has an untreated behavioral health condition. The average wait time to get in to see a licensed clinical social worker or a psychologist currently is about 60 days. This is not through our service. This is if you try to go and find a practice where you can go see somebody. A lot of psychology practices, mental health practices are full. They're not taking new patients. Over half of the counties in the United States don't have one mental health professional. And 2/3 of all the people who have a diagnosable mental illness don't seek treatment. The reason for that is really twofold. One is lack of access. Since June of 2020, which we all know what that was, pandemic, there has been a 574% increase in the amount of people seeking mental health therapy. Part of that is an increase in demand from the pandemic. Part of that is the stigma around mental health is going down a little bit. People are not as worried about getting mental health counseling as they once were. The stigma that's placed on that, it's still there, but it's not nearly what it used to be. But a lot of people don't seek help for a few reasons. One, there's lack of recognition that help is needed. There's lack of awareness about the services. Most importantly, there's lack of services, just finding somebody. And also, again, the privacy and fear of stigma. Nobody wants to be seen in a mental health office in their local town, or have their family or friends or neighbors or anybody know that they're going there. So they just go without care. So with our service, what's nice is that, again, this is all done remotely. So you can have a 1 hour face-to-face via video, just like we're doing now, consultation with a licensed clinical social worker, psychologist, or psychiatrist for really anything that you want to discuss with them. What you see on the screen here is just an example of some of the more common issues of things like grief, depression, PTSD, anxiety, stress. I'm not a therapist. That list can go on and on and on. But this is a service that is in such high demand. It has such a wonderful benefit to it. And we're happy that you guys are really, you're going to be getting this. So again, the provider network, it is the largest virtual care network in the US. There are over 2,000 state licensed board certified therapists nationwide that are part of the program. We have to adhere to the National Quality Control Association, all their credentialing and monitoring. Again, everything is HIPAA and privacy compliant. The therapists have an average of 10 years of experience. So one of the things I want to point out is that the average appointment time, if you go and try to find your own therapist out in the market today, is about 60 days or more. Our average appointment time is about 5 to 7 days. So if you today wanted to talk with a psychologist, you can go on our web portal, you can go through our app. What I really like about the app is that you can actually see all the providers and kind of screen them. You can read their biographies, you can see where they went to college, how many years they've been practicing, their specialties. So if you're looking for somebody that specializes in anxiety or specializes in grief, you can narrow that down, select the one you want, and then see their availability and book a time with them. At the end of that first call, you have the ability to schedule a follow-up call with the same exact therapist. So you're not starting over with a new therapist each time, you're building upon the previous session that you had. So if they give you something to work on, whatever counseling, and you work on those things, when you talk with them again, they're going to build from that point going forward. So the provider types are psychologists, psychiatrists, licensed professional counselors, there's licensed marriage family therapists, and licensed clinical social workers. So there's a difference between psychologist and psychiatrist. Psychologists, licensed professional counselors, family therapists, clinical social workers, they all fall into the bucket of talk therapy. The way that they treat their patients are to have a one-on-one conversation with them and obviously talk through all the issues and give them a lot of things to work on. If during the course of that care, the psychologist or the other therapist, uncover there's a larger need here for this particular patient that requires medication for management, then they can connect them with a psychiatrist. So the difference there is psychiatrists are medical doctors that can write prescriptions, psychologists and therapists cannot. You have access to both through this program. So the way this works is there is a $0 copay, which I can tell you guys is a phenomenal benefit that this is being paid for you. Most mental health therapists today are charging $125 to $150 an hour. The fact that you get 10 sessions per family per year is enormous. Again, you can talk with a licensed therapist or a psychologist. We have a very, very small percentage of our clients who ever need to speak with a psychiatrist for medication. If you do need to speak with a psychiatrist, that is something that is not included in those 10 sessions. There's just a fee that would have come with that. Again, that's not something that we're trying to provide. It's just there because if you happen to fall into that category where you need medication for management, if you try to find your own psychiatrist out in the marketplace today, there's a very high probability you will not find one that's accepting new patients. And if they are, it could be 6 months' time before you can get in to see a psychiatrist. So we can provide that based on what your needs are. There may be certain fees that apply. Again, all of this is done from the access of your own home. So the telemedicine, the mental health counseling, the beauty of it is you can be at home, at work, on the road. It doesn't matter where you are. You have the ability to talk with doctors and therapists remotely. And it's so convenient. It will save you a ton of money. And I'm telling you, if you have other family members, in your household, and you don't have to run out and go through that, you've probably all done something like that before. The convenience factor is immeasurable. So that's everything. I think I'll turn it back over to Maura just to kind of review everything on how to, get this set up.
Thank you so much, everyone, for giving us your input and telling us how this is going to work. We're so excited to bring this to everyone on the registry. I did have one question, a follow-up question. I don't know if Michael or Brandon can answer this, but if someone already has benefits through their job or their partner's job, will this negatively impact those benefits, or can they still sign up for this as well?
They can still sign up for this. ALLYHEALTH does not fall within the category of an insurance product. So we have hundreds of thousands of customers, and most of them, 90+% of them, probably have health insurance someplace else. It does not affect that at all. You can talk to a doctor on the phone today because your son or daughter has an ear infection, and then you could take them to the doctor next week for the routine checkup. The two do not coincide. If anything, it's going to reduce the amount of claims against your insurance policy, which is going to save you money.
Awesome. Thank you so much. And one more, the 10 free sessions, if they did need to go past that 10 sessions, do you know what the copay would be past that, or
Yes.
Would it be based on? Okay.
No, it has nothing to do with insurance. So our cost, and I'll be very transparent with you and everyone on the call, our cost for mental health consultations is $90. So those first 10 that are included is a big deal. So if you want to use an 11th consult and forward within the first 12 months, you can. You just pay our consultation fee, which is $90. We just pass through our cost. Once the year resets, so which will be February 24, then it resets for another 10, and you can use them again. Very rarely do we see people go over 10, which is why we arrived at that number. But we don't want to deny somebody, the service if they need to use it. So they're welcome to use it. We just, based on the pricing model we have, we include 10, but they can go above that and just pay themselves.
Awesome. That is fantastic. Thank you so much. Again, so excited to be able to bring this to you all. this is recorded and it will be posted. So tell your coworkers and everyone you know to go and register on the Nevada Registry. That's your first step. And if you are registered, make sure that your information is updated and correct so that when the open enrollment starts on the 15th of January, you will see that little bar on your homepage and then be able to sign up. So we're so excited. And thank you so much.